Hey, Billy Gliston with PowerCore 360. In today's video, we're going to dig a little bit deeper into the transverse abdominis and talk about three other common exercises that we see happening in any fitness studio that benefits the fitness person, the weightlifter, or the athlete. Hey, Billy Gliston with PowerCore 360, here again with Greta. And the last video we did, we talked about the importance of the transverse abdominis. And it would be real easy in these days to just blow through that and go on to the next subject. And as we talked, we thought about, there's a lot of, it's really important. There's a lot of exercises commonly done in my world with athletes and your gym and with fitness folks where we need to really apply that. So we thought today we would talk about kind of three common exercises that athletes use and Greta uses in the gym, and talk about the importance of how to turn on the transverse abs and how that's going to help those people get more out of their exercises, get more benefit from it. So that being said, Greta, give me the first maybe common exercise you see or you use a lot with your clients.
A hip flexor stretch.
Okay. So do me a favor, do a common hip flexor stretch for me, right? So you're down on the ground, and do this, switch your legs around for me, okay? So go ahead and do your hip flexor stretch, and maybe in this case, just put your hands up across your chest. And as she's doing this, she's taking her hips forward, and she's going to take that just like anybody would till they feel a stretch on the front of the hip. Hip flexors, maybe they're going to feel it in the quad, might feel it in the groin, kind of depending on what's tight. What I want her to notice is, though, or what I want you to notice in the camera, there's a lot of arch going on in the back. Most people don't realize that's there, and they're really getting a lot more stretch arching their back than they maybe are necessarily in the hip or hip flexor. So back out of there, and let's really quickly go through 2 reps of kind of the transverse abs activation. So you're going to be laying on your back looking like it's going to do a crunch. Quick review once again, hands are in the front of the pelvis, take your fingers in, take your belly button basically down into the floor, push your lower back into the floor, turn on your pelvic floor, breathe. Hold it 5 seconds, 10 seconds. And let's assume she's done at least 4 or 5 reps of that, okay? Now let's go back into that hip flexor position. And this time, before you go forward, I want you to turn on your lower abs, and I want you to keep them on and go until you feel a stretch, okay? Now this just changed because she's keeping her lower abs on, she's getting that stability that we talked about through her lumbar spine and through her pelvis, that lumbopelvic stability. She's got more control through there. She's still getting a really probably good stretch. In fact, I know she is. I can see her shaking over here, right? So we're getting a really quality stretch here without overarching the back. And we don't really want to arch the back. That's a pattern a lot of athletes get into and a lot of fitness folks get into. They have back pain and they wonder why. And it may just be how they're doing their exercise. What feels different to you? Go ahead and relax. Turn your transverse abs off. Do it there. Come all the way forward. Let your back arch. Okay. And then come back and do it with your abs, lower abs on. Hold that. Breathe. And tell me the difference in your words. What do you feel that's different?
Don't feel the stretch in my lower back or any pressure in my lower back, and I feel more of a stretch in my psoas and my quad.
Cool. Awesome. Very good. Okay. All right. So one of the things I would suggest to you, both for your population and my population of athletes, is they'll get a lot more targeted benefit from the hip flexor, quads, groin, whatever's tight on the front side if they just kick that on and hold that on while they're doing it. Okay. What's next?
The forward lunge.
Okay. Cool. So let's go through, do your lunge. You can lunge forward with your right leg if you would, and do it just without thinking about it, okay? Cool. And back up, and let's just do one lunge and hold it. Hold it at the bottom, okay? What are you feeling right now?
I feel tightness in my quad.
Okay, cool.
And very kind of unstable.
Okay. Depending on the person's flexibility, they may actually come further forward, so drive your hip forward, let your lower back arch, okay? So if she keeps her back up like that, chest up like that, now we're overarching in the wrong places here. All right, so fix it for me. Kick your transverse abs on, keep them on, do your lunge for me. Okay? Do a few and then tell me what you're feeling.
Feel more stable.
Okay. And what do you mean by stable? What does that mean?
Stable, so not like wobbling back and forth. I feel
Okay.
more controlled. I don't feel it in my lower back
Right, cool.
at all.
So what she's feeling is what I would expect when we're talking about lumbopelvic stability, the control, if you would, of her lower back and her hips and pelvis and being able to maintain that. Hand me that spine, I'll give them a visual. So as she's doing her lunge and coming forward, what we're asking her to do is control her lumbar spine, her low back, and her pelvis, and have those two move together as she comes down, so she's hinging at the hip and not bending and arching at the lower back. That's why that would create that pain back there. She'll get a really nice stretch on the front of her quads, hip flexors, groin, whatever she's trying to stretch. She'll get much more out of it and walk out of here feeling good about the exercise. And if it's your client, they're going to feel better about you or better about me, right? If we're doing the right thing to help them with the quality of the movement. Okay.
If you like this video, please like us down below, subscribe to our channel. If you need further information about our products, go to powercore360.com.